So with a lot of my audience, they are in that, perimenopausal age group. They are experiencing fatigue, they're experiencing difficulty with weight loss, arthritis, muscle aches. And we
Mhm.
know that it has to do with like changes in your hormones with the perimenopausal age group. Can you tell us about that a little bit?
Yeah. And so, that's something that I get asked often as far as what happens with my charting. Can I still use this throughout perimenopause in order to avoid
Yeah.
pregnancy? The first answer is yes. The second
Okay.
answer is that your cycles do change significantly as you are in that perimenopausal time frame. So, just kind of as a background, perimenopause can begin up to 10 years before your periods actually turn off. And a lot of people
Yeah.
aren't aware of that. And so some people just
Yeah.
think, I'm going crazy, I'm stressed out, my kids are driving me nuts, whatever. And the reality is, no, your hormones are starting to change even if you're in your mid
Yes.
30s to early 40s. And so
Yeah.
there's two primary hormone shifts that happen in perimenopause that will kind of throw things off. The first is that we generally will see your progesterone levels will start to decrease. So progesterone
Okay.
is a very important hormone that's typically responsible for helping the timing of your cycles. So progesterone will spike after you've ovulated. And then if you're not pregnant, it will decrease and then trigger a next menstrual cycle to start. So if you don't have that nice spike and then a decrease of progesterone, your cycles sometimes will start to get shorter. People who are deficient in progesterone oftentimes are a lot more moody, a lot more anxious, because progesterone is typically a very calming hormone. And so when we have
Yep.
less of that in
Yep.
perimenopause, we just get a little more agitated. So progesterone is the first, and the other is your estrogen levels start to do this crazy roller coaster where they can
Yep.
be really high, they can be really low, and everything in between until eventually you reach menopause, and then they literally just decrease and kind of go into the silence. And so if we
Gotcha.
have this progesterone that's decreasing this whole time and estrogen that's going bonkers, you can imagine your mood is going to be all over the place. And so it's
Yes.
really challenging to say, what's going on? But when we are tracking our cycles, we can identify, okay, where am I at in my cycle? What am I observing? And then, most
Correct.
importantly, from a medical standpoint, to see, okay, what are the labs showing? And does it show that I have a progesterone deficiency? Might I need something to help boost my progesterone levels, whether that's bioidentical hormone replacement therapy, whether that's foods targeted to progesterone? For a lot of us, it's just a matter of lifestyle changes, getting enough sleep, getting enough exercise. And I think those
Yeah.
would be, from a hormonal standpoint, the kind of the two big things. The other thing that unfortunately hits us during perimenopause is a lot of times we're very impacted by stress. So, cortisol
Yes.
hormones,
Yes.
thyroid hormones, all of these things can kind of start to take a nosedive. And for some women, they experience multiple things all at the same time, and it can be very traumatic. And so, making sure that you're working with a healthcare professional like Dr. Odoy or myself who's able
Yeah.
to manage and navigate these things is incredibly important, because it's not just here, let's put you on birth control and it'll help regulate things, right? Or let's
Exactly.
give you an antidepressant and you're going to feel better. No, because you're going to have terrible side effects and it's not fixing that underneath problem. So that's that whole idea.
Exactly.
Address the root cause, fix the underlying problem, and
Yeah.
help to educate you on this is normal, but it doesn't have to be something you suffer with.
Exactly. And I was just on the phone with someone who called, to do a discovery call. And she, she just came back from her OBGYN, going through the perimenopausal typical
Mhm.
symptoms, and was told, that you can't have the hormones come back after you've not had your period for 12 months. And the
Mm,
woman is like, but I'm suffering right now. Why
yeah.
am I waiting for 12 months before I
Yes.
can come and get help? And
Right.
then they were like, the doctor was like, well, I can put you on low dose progesterone um, to help. And the patient was like, you just told me hormones are not good, why are you
Right.
offering low
Yes.
progesterone? So I think that women get these messages that fatigue and joint pain and muscle aches and the weight gain, it's just all part of life, and we are
Yes.
just supposed to accept it and figure it out. And what it's really not true, and I don't think it's fair that some, we suffer through this till we get to menopause and everything, is declined. And and for me, I think passion, from my passion of why I went into this area for women, is that during that perimenopausal age, when you are having these like drops in your hormone and things that, estrogen is up and down, your cortisol is elevated, that's the window that we develop these metabolic diseases, like the pre-diabetes, the high blood pressure, the high cholesterol, because you are not able to exercise because you just don't have the energy
Right.
or the desire to. And it all looks like it's clinical depression. So then you get put on SSRIs, which
Yeah.
cause more weight gain.
Hmm.
And then you are just like in this cycle. Um so so I really love the idea of like tracking your cycles on your own and knowing yourself.